2, and 1.
Good morning and welcome everyone to our 5th day of training. And I'm happy to be back again. Today, you're going to hear a lot of what you've heard already, but I'm also going to add in some of the COVID aspects. So I'll go ahead and share my screen so you can see what I'm talking about. So again, focusing on disrespect as far as elder abuse, financial exploitation, and COVID. And OCO, or welcome again. And as you can see, I wear many hats. NIEJI is the National Indigenous Elder Justice Initiative, and our mission is restoring respect and dignity by honoring our Indigenous elders. And the things that we do, including developing culturally based resources. We help tribes to develop their elder abuse codes. We talk with tribes and help facilitate cross-jurisdictional issues. We have online education for professionals. And we do a lot of training and public awareness. So I've talked a lot this week about elder abuse. As far as elder abuse in Indian country, it is not the way we were raised. Although in some cases we see elder abuse occurring in homes where there wasn't those traditional values that respected elders and were positive in how they were raising children and things like that. And sometimes that comes back to influence elder abuse in Indian country. Many times when we talk to elders, they don't consider themselves to be abused. But when we use those terms of disrespect, mistreated, then they start to tell us a little more about it. As far as who is a native elder, well, it varies from tribe to tribe, but usually they're over 55 years of age. They have knowledge of the culture, and they have wisdom from life or education. And this is often confused because this term is used more in the general population to talk just of someone that is over a certain age. But we've tried to differentiate a little bit between elder and those that are over a certain age by using the term elderly when we address someone that's just over a person's age. But many times our elders are very special within our tribes. So again, elder abuse is any knowing, intentional, or negligent act by a caregiver or any other person that causes harm or serious risk of harm to a vulnerable adult. The different types include physical, emotional, psychological, sexual, neglect, self-neglect, abandonment, spiritual. And remember all of those because you'll be tested on them later. Okay, what are the numbers? As I mentioned earlier, unexplained falls is one of the criteria for elder abuse. And when we look at what happens with our native elders, almost 40% have fallen in the past year. That doesn't mean they're unexplained. It just means that we need to start asking questions about those falls. Do we need to look at taking care of doing a safety check, or what are the causes of them? Malnourished or inadequate food is another symptom of elder abuse. And 1 in 6 of our native elderly report eating less than 2 meals a day. So sometimes that's only the meal that's delivered by senior services. They're either unable, they have no help to shop or cook or feed themselves. And so 1 in 9 of the Native elderly surveyed reported that they were unable to shop, cook, or feed themselves. And 1 in 8 Native elderly report that they don't have money to buy food. Who are the victims? Any older adult. Generally it's 60 plus, but it depends on the tribal definition. In some tribes it goes as low as 50. And then usually those that are disabled are also included. Those that are disproportionately affected, those that are isolated, who may be living in poverty, who have cognitive impairments like dementia or Alzheimer's. We're seeing so much more isolation now and poverty because of the COVID, that those are things that we really need to be checking on with people as to how that's impact them, because it puts them at higher risk. And women are twice as likely to be victimized as men. And also residents in long-term care facilities are more at risk. Again, who commits the elder abuse? Somehow I feel like today you should be answering these questions. The intimate partners. They live there together, like we see in even multi-generational homes now. With COVID, people are isolated and all living under one roof 24/7. There gets to be a lot more fraying of nerves and people irritating one another, and there can be more lashing out and things happening, whether it's intimate partners, adult children, or other family members. And as we talked about yesterday, grandchildren, all of those have issues that come up when you're all crammed together and you don't have a way of kind of giving one another some space. Caregivers. Many caregivers usually get into that because they want to take care of someone or they're in a position to take care of someone. But sometimes there are caregivers that get into that in order to be able to abuse and exploit those that they're taking care of. Fiduciaries, those that help to manage the money of the elderly person, can a lot of times commit elder abuse. And that's why there should be either a review by the court or there should be a secondary fiduciary that reviews the records to make sure the money's being spent where it needs to go. Others who are or put themselves in positions of trust or authority. So whatever that position of trust or authority, it could be, you know, someone that helps with just about anything that can exploit that. And then we have the strangers, many times scam artists, who take advantage of our elderly. Why does elder abuse occur? I've talked before about things as far as people that are motivated by greed, by the benefits of their predatory behavior, sexual and financial primarily, but sometimes it's people that benefit from the physical abuse, that, you know, that's something that gives them satisfaction. And that comes also under the power and control dynamics. And that can be similar to domestic violence. And sometimes if it was a violent home growing up, that child who's a caregiver now of an elderly parent may be exerting some of those same dynamics because they now have power and control over that abuser. Sometimes it's people with very good intentions. They're caregivers that even when they're trying to provide care, they incidentally cause harm. And in these cases, it's more working with that person and helping to get them training into how to do things with the person they're caring for that won't cause harm to them. Physical and mental health conditions, substance use, when, you know, people are using alcohol heavily. They may have more falls, they may have more injuries, things like that. Mental health conditions where they can't control their behavior, they may lash out, they may feel angry or afraid, especially with dementia and Alzheimer's patients, to where, you know, they don't recognize anyone, they don't recognize where they are, and in that fear, they can really lash out and maybe hurt someone. Why Native elderly are at risk? Well, our Native values help to set us up to be taken advantage of. The generosity, that we're willing to give what we have to others, that we want to take care of today. And we feel like if we take care of today and we're generous with others, then when we need help, they will provide what we need. And sometimes that doesn't happen. A person's family role or their position that they take advantage of. And then our respect for our elderly, and especially our elders, that we expect the elders to be treated with respect. So also, some of the vulnerabilities of our Native elderly include when we're dependent upon others to help us. That, you know, it's really hard sometimes to ask for help or to know that you need someone to come in and help take care of some things. And when they don't want to report because they don't want their caregivers or a family member to go to jail. So they're very forgiving of that. And it's like, if that person goes to jail, who's going to take care of them? Is there anyone else? They're forgiving of their family members, and they've spent their lives taking care of family. So they're vulnerable when family comes to them and telling them that they need or, you know, expect things from them, that tends to hold greater importance. And so they give that to them and they go without. And then when they go to IHS, they're seeing different providers every time when they go in for health care. So there's no continuity of those relationships. The other thing is you don't necessarily know when something needs to be reported. IHS does not have a mandatory reporting policy. They don't have any policy about elder abuse because it's different in each tribal area. So each clinic would be dependent upon what the requirements are of that tribe. So it's important to work with your IHS administrators to make sure that they know what the mandatory reporting requirements are for the tribe. As far as the financial exploitation, we've talked a lot about that. The exploitation of property, resources, and assets. Denying that elderly person access to their own assets. Stealing and hiding their things. Purposeful mismanagement, deception, where the person starts hiding those resources. Sometimes, you know, we start forgetting where we put things, and it makes it really easy for people to steal those things. I remember one woman telling me that, you know, they all didn't know what to get the grandparents, so they were giving her gift cards for different places. Well, she was helping clean in the house one day, and she found a whole stack of gift cards sitting on the bedside table. They weren't being used, and they were very easy right there for anybody to just put in their pocket, a handful of them, that she had so many sitting there. So helping them to secure their assets, and then, you know, making use of those types of things, following through in maybe taking them shopping or helping them to utilize those gift cards if people use things like that. Fraud, extortion, forging, scams, identity theft. I talked in great detail about some of that. And improper use of legal documents. We talked quite a bit about the different expectations, like tribal judges really look at there being lots of evidence, you know, someone going into a bank account, which is, you know, a federal offense or a state offense. Title VI directors hearing a lot of the stories about family gambling their money away or taking their personal items or taking their checks. But then talking with the tribal elderly themselves, you hear the stories about wrecking the car and pressuring them for money and cashing their checks or locking them in a room. All of those other things, those stories come out that may also very likely be elder abuse in some aspect. So, what are some of the effects? They can't recover those resources. You know, once you reach a certain age, you can't put those things back in. The elderly don't want the family caregivers punished, and as I talked about before. And then they've lost those resources to meet their own living needs, the food, the shelter, the utilities, transportation, paying for their care, and medications. Now, some of the issues for the tribal elders, those loss of resources, the cross-jurisdictional issues that can make things very murky as to who has jurisdiction in this particular situation, and making sure that you involve the right jurisdictions with anything that's going to be carried forward, whether it's banks or the Adult Protective Services or the state APS, or which law enforcement and which courts are going to be involved. All of that is important. And also housing, not just them having their housing and being able to, you know, pay for their housing, but in HUD housing, if anything happens as far as a drug offense, maybe someone moves in and is dealing drugs out of their house or even making drugs in their house, they aren't allowed to live in tribal housing anymore. And in the case that, you know, sometimes they can get a one-time kind of forgiveness of something, but they have to really make sure nothing like that happens again, or they could be out of housing and then they don't have anywhere to live. I talked about a lot of different scams that target the elderly, and some of the things that you can do as far as addressing those or identifying them so that they're not things that people will fall into. The Medicare card scam, IRS and tax scams, counterfeit prescription drugs, funeral and cemeteries, telemarketing, phone scams, sweetheart scam and the lottery scams, the grandparent scam, the internet fraud and the types of things that are happening. But I wanted to get today, you know, I've covered all of those already. I wanted to get today to some of the COVID-19 scams. I've heard from tribes where the elderly get calls to get information and have their stimulus payments diverted. So they'll call to get all their contact information and everything, and then they'll divert where that payment is sent. Or children or someone else living in the home demanding their share of the stimulus check. Or attempts to get their name, their social security number, a debit card number, birth dates, all kinds of personal information. So the top COVID-19 scams of the elderly are home test kits for COVID-19, bogus COVID-19 related products and services, impersonating a government agency, insurance scams, stimulus related scams, and charity scams. Now, I've talked quite a bit about the insurance scams, the charity scams, and the impersonating a government agency, like with the Medicare and the IRS and all of that. So I really want to focus with some of those that would be new information today. So the COVID-19 scam, the test kit scam, they call or they text message offering a COVID test kit. And we know how hard that has been to get everybody tested that needed to be. And a lot of times our elderly may be at home and may be afraid and think, well, if I could get a home test kit, I would be safer in doing it. They request credit card or bank information. And some even pose as officials from Medicare and Medicaid services asking to verify their Medicaid ID number or Social Security number. And then they provide a home address, want them to provide a home address so they can drop the kit off instead of mailing it. The bogus COVID products and services, again, a lot of them are text and phone scams, falsely advertising products. There are fake drugs, vaccines, and devices that claim to prevent or cure COVID-19. And knowing about how much misinformation is out there, that they scare these elderly people into, that they need these things in order to be able to defend themselves against COVID-19. So they really prey on their fears. Another fear is that one of shortages. So they're kind of stock up scams where they have to purchase, whether it's toilet paper or cleaning supplies, at drastically higher prices. Some of the other scams include in-home HVAC cleaning or mosquito abatement, or a fake gift card email for assistance or rewarding them for following public health guidelines. And as far as I know, nobody is getting any gift cards because they wear a mask. Stimulus related scams. And since they're talking about a possible another round of stimulus, some of those scams were associated with the stimulus payments and loans as part of the government response to COVID, and either ways to get the payments sent to the scammer instead of the elderly, or some of it even has to do with how those stimulus payments were sent out. Not having the right address for some. They came in just a plain white envelope. And especially when they went to using the credit card or debit card types of stimulus, that you get this card in this plain white envelope that looks like all of these other credit card applications. And a lot of people just tossed them away. They didn't, they just thought they were another credit card application. And they want people to provide bank information so that the funds can be released or for their stimulus or their loan applications can be approved. And they're not going to ask for your bank information if it's not already, if you haven't applied for this. And as far as the stimulus, they're not going to ask for any of that information. They either have it already from paying your taxes, or they have other means that they were distributing them. And so they're not going to need it for that. And any loan applications for COVID-19 loans for businesses, it'll all be on your application. So they don't need to ask you for that. So what do they need to do? Well, don't answer calls or respond to text messages from anyone you don't know or a suspicious number. And a lot of times now the robocalls are spoofing phone numbers within your area code, so it'll look like it's a local number. But if you don't have it, and if I don't have a name that comes up that I know, or a number that I know, I don't answer it. If they don't leave a message, then it really wasn't important that they get hold of me. If they leave a message and it's someone that I know and it's something I need to respond to, then I will do that. Don't share personal or financial information over the phone, by email, or text. Just don't give it out that way. You know, I had a contact about some extending an insurance policy on my car. And I don't know where these calls are coming from. Are they coming from the car agency, or are they just coming from somebody trying to sell me insurance that I don't really need? You just need to be careful of all of those things. Be suspicious of any caller who pressures to make immediate payment or to share personal information. If they get more aggressive and press more, hang up. Refrain from clicking suspicious links in text messages or emails, even if you think they come from a friend or family. As I talked about before, make sure you look at the actual email address, not just the name that pops up, because sometimes people have spoofed the name onto another email address and are trying to take advantage. Verify any charities by calling or checking the organization's website before any giving. So, at this point, I'll say, any questions? I haven't looked at I can't get to the chat box, so you'll have to tell me if there's anything in the chat box, May. No questions? All right, it's time for your test. So I have some statements that are about different types of abuse or neglect or exploitation. And then the box with the possible answers up across the top. So, and you can just put it in the chat box. Illegal or improper use of an elder's funds, property, or assets. Which one is that?
Financial abuse.
Financial abuse, okay. Corruption of another's personal value system.
Spiritual abuse.
Okay. Anybody have any other answer? It is spiritual abuse. Refusal or failure to fulfill any part of a person's obligations or duties to an elder.
Neglect.
Neglect, okay. Anybody think it's something else? All right, it is neglect. The use of physical force that may result in bodily injury, physical pain, or impairment.
Physical abuse.
Physical abuse, that was a good, easy one, wasn't it? It has physical right there in the question. Behavior of an elderly person that threatens his or her own health and safety.
Self-neglect.
Self-neglect. Anybody thinking something else? All right, it is self-neglect. Sexual contact with any person incapable of giving consent.
Sexual abuse.
Sexual abuse. Anybody think it's something else? Yeah, it is sexual abuse. The desertion of an elderly person by an individual who has assumed responsibility.
Abandonment.
Abandonment. Why? Because that's the only one left? Okay. No, you guys did great. And let's get on to your questions. So I'm going to stop share. And what questions do you have? You can unmute yourselves now and we can talk. I put you all to sleep.
You do have a comforting voice.
Oh, I've hypnotized you all and you've gone into trance. All right. So were any of those COVID scams anything new that you hadn't heard about?
A lot of these scams kind of piggyback off the ideas of a lot of the other scams, like the old genetic testing that's been really big lately. Now it's the COVID-19 home testing.
Right.
So, I mean, I just can't imagine a home kit for COVID testing, seeing what the actual COVID testing is. I can't imagine wanting to do that to myself. So, yeah,
Well, but I think it's the idea though.
yeah.
We've got so many elderly that are afraid of going out that they're like, and they talk about all these different kits that are available and things like this when you hear news reports and things like that, that they start believing that those are available.
Well, and I think it's really good for the elders from a logistical mindset, because now they're, especially for some of our more rural elders that are far removed from some of the more metropolitan areas of the states, that, you know, oh, well, I don't have to drive into my local clinic to get a test. I don't have to do this thing. I can just swab my mouth or whatever it is and send it off, and they'll just bill my insurance. That's a pretty sweet deal for a lot of people. It reduces their risk, and it reduces the need to find somebody to maybe take them somewhere.
Yeah, the time and the transportation involved.
Yeah, I think for a lot of seniors on fixed incomes, that's a pretty sweet deal when they break it down.
Right.
So that's why I think a lot of times these scams become so big, is because they are very appealing to our senior population, because they are isolated. Transportation right now is limited, and finances are limited. And if they know that all they have to do is fill out their Medicare number and it's going to go somewhere and it's going to get billed, why not?
Any of the other ones that you hadn't heard about? Or yeah, I think it's really important when the stimulus starts coming out that you get information out to your elderly as to what to watch for. Because like I said, the debit cards that came out were just in plain white envelopes. And what we did was we put a copy of, you know, a card like the credit card or the debit card that they sent out on our website when we flagged that for people to watch and to, you know, to expect something like that to come, because they started doing that after they did the checks. They did the direct deposits first, and then they did the checks, and then they did the debit cards. So, you know, helping them to know kind of what to expect and when to expect it can help to cut down on some of that. Other things that you had not heard of before or kind of surprised you? I'm sure none of it surprised you. Or things that you've heard of that I didn't have up there. This is how I revise my presentations, is by information that I hear back from people that are actually out in the field.
Jackie, this is Malin. I have a maybe I guess I kind of know the answer, but it's just something that maybe not everyone does. But why? Maybe can you talk about the reasons why elders are more apt to falling for scams than other individuals? Why they're more vulnerable?
Well, a lot of times, you know, their hearing isn't as good. They, you know, they're confused easily. You know, you get somebody talking fast and throwing all this stuff out and talking about the sheriff coming or something like this to get them. They start getting scared and they have trouble processing the information, and pretty soon they're apt to give them anything they want. There are, you know, a number of different things that feed in. What are some of the things that you guys think impact that? And May, you can respond to.
I think one of the biggest hindrances to stopping scams from happening is social isolation of our elders.
Yeah.
Especially during this COVID-19, it's increasing exponentially from what it has been in the past. And so, you know, family members are fearful of visiting their elders because they don't want to risk getting that elder sick, those sorts of things. The elders are fearful of getting in contact with the family members and asking for help because they're fearful of the same thing.
Mm-hmm.
And so social isolation, I think, across the board, regardless of COVID-19 or not, plays a major factor in the impacts of these scams for our elderly population. They're lonely. They want interaction. There's somebody that's talking with them, even if it is a million miles an hour. And
Right.
so the risk of that is, you know, they are wanting to help. And these elders have a history of wanting to help people. And so if it's, you know, the grandparent scam, if it's whatever it is, they're going to want to do it because at the end of the day, they're still their grandparent. And they love those people, and so they want to help. But secondly, I don't think anybody wants to go to jail when they're in their 70s or 80s.
Right.
You know, and sometimes, you know, some of these elders have had negative experiences with law enforcement or been threatened by their family members to use law enforcement to get them out of the home. And so it's just another factor, these scare tactics that these scammers use. So I think social isolation is probably one of the biggest keys to impact scams across the board.
Well, the other thing is, like, you know, being able to go to their senior centers. And if they get some information about some of these scams and things like that, then they end up talking about, oh, well, I got a call like that the other day, and this is what the person said. They process that information with one another. And so they're less likely to be taken in by it because they're familiar, because they've heard something about it. The other thing is, my generation was not raised to just hang up on someone. So, you know, you try to respond and say no, and then they just keep coming back, and, you know, it's rude to interrupt them. And we just weren't taught to hang up on people. And we were taught that that was impolite, that it was impolite to interrupt someone. And so they have a lot more difficult time actually hanging up the phone. What are some other things that you think impact our elders that make them more vulnerable?
This is May. I also think that cognitive decline also plays a role, and that there have been also studies done where an elder can be given the correct information about a scam, like, this is a scam, don't fall for it. But like an hour or so later, they have someone do the scam on them and they fall for it. And so there is the issue of, even though we provide education, there is just with cognitive decline, the inability to process some of the information that's given.
And a lot of times elders are still living on their own independently. till that cognitive decline progresses until it's really obvious they can't take care of themselves. And so there's a whole window there that makes them very vulnerable. And that's where initially, when that decline starts, and even normal aging, that decline is where you get that confusion with the fast talking and the aggressive people on the phone. But then if they have dementia or Alzheimer's and it progresses more, like I said, it's a long time before people really step in and notice that there's something major happening and the person can't take care of themselves. I know my uncle who had Alzheimer's lived independently and went to visit his wife in the nursing home every day that had Alzheimer's for years before the family recognized that he did too. And he would be out driving and off different places and they had no idea where he was. And sometimes he didn't either, but he wasn't going to admit it. So, you know, those things can be really scary, but you've got that big window from the time that those symptoms first start until it's really recognized and someone intervenes and actually gets care to them. Or Marcia, yes, you are muted. Let me, whoops, get to Marcia's audio, unmute. Okay, you've been unmuted, Marcia. I'm still not hearing you. Oh, there, okay, now.
Well, one of the things that I want to reiterate what Brian just stated, the other thing too is in my years of being in this role is some of the elders, when they don't understand something, automatically they're gonna play like they do understand because they don't want to come up stupid or, you know, like, and they want to have that authority role still visible. And so a lot of times, you know, we could explain to them and show them in detail and they won't get it. And a lot of it goes back to, you know, them not understanding, but then also the fact that a lot of them have the poor eyesight or they do have the issue with the hearing. And so that also is a barrier when they're trying to do, I mean, like for instance, when we've had individuals that co-sign for cars and stuff, and it was one of the things that the salespeople took advantage of was because they couldn't hear nothing. But then when you get a bill for your whole monthly income for a 2020 car, then it's like reality hits and it's like, wow, I had no idea I was signing for this. And so that's one of the things. The other thing too is a lot of these, like going back to, like you said, the charity. My mother was actually, I was just telling the two ladies that I work with that my mother was in the midst of giving all her information because she had been, you know, when they do the firemen's donations, they put the boot out and then well, they were doing online payments. And my mom, she's like, well, I donate to them all the time. And she was already doing all that. And I said, well, can you send us the information? I'd rather see it in writing before we do anything. And a lot of times it just simple stuff like that. And it makes it difficult, you know, because when, like I try to explain to my mom, there's a lot of times that something may sound really good, but then in reality, it's not, I mean, it's not healthy practice when you're given your information.
Well,
people,
and just because it's something you always give to doesn't mean that the ones that are contacting you really represent that group.
Yeah. And it goes back to, you know, when you have a number, the caller ID, I always tell my mom, check the caller ID first. If you don't recognize the number and it doesn't say where it's from, then it's not legitimate. You know, you have to be more proactive and and check those before you start giving your social security number and your credit card number and stuff, because yeah, she had, in fact, she had charges on her card that we had to actually go back and contest those. And it was a good thing that, you know, the bank has been more proactive if they see strange charges on something. From if you live in Idaho and all of a sudden you've got a charge in Florida, then they're automatically calling and saying, hey, there's some strange activity. Is this you? Which is really good, because, you know, that's just one of those protection, you know, protective measures that she's really lucky that she participates in.
And there's
So,
more of that happening now than there used to be, because there's been so much more online and telephone and making use of credit card numbers and things like that, and data breaches and all those other things that I talked about.
Hey, Jackie, along with what Marcia said, sometimes I think that not only do they not always understand or hear everything that was being said, they're afraid to ask questions and ask others to verify if that is correct, and then they get too far into it, and I think a lot of times they feel that shame. They don't want to tell anybody that they were taken for a scam.
Right. Yeah, that shame really comes in, and not, you know, it's an embarrassment to say, well, I can't hear as well as I used to, or, you know, I'm not, you know, I'm confused by what you said, or something like that, that they don't want to admit that they're less than what they once were.
Yeah.
Okay, any others? Marcia, are you talking again? Oh, okay.
I've been talking all the time. No, I'm talking to my employees.
Okay, I was just checking.
We were just talking about some of the things that we do as on our own personal phones about, you know, all these strange numbers, and we start blocking one, and then once you get it blocked, then another call comes from that same place, but it's at a different number, you know.
Right.
Or yeah, so it's.
And that's where a lot of times it'll, like my phone number, when I first got it, they didn't have any, I don't know, where they gave out phone numbers for North Dakota. And mine is in East Grand Forks, so a Minnesota telephone number. So I get all of these spam calls from Minnesota numbers, but they're not anybody I know.
Yeah.
So I don't answer them. It's not like it used to be that it's just a wrong number or something like that, where, you know, you can answer and let the person know it's a wrong number and they won't call you back. Now they're like robocalls that just, they spoof numbers. And sometimes it'll come through with a name on it, but it's still a spoofed number.
Yep.
And it's really hard, like I said, to get across to our elders that, number one, you don't have to answer the phone. And number two, you can hang up on someone. Those are things that you may really have to go through a number of times and then do some practice with them. You know, ring, I'm, you know, so-and-so from such and such, and you have them practice hanging up.
Yeah.
Or finding the button to hang up, or, you know, things like that.
Yeah. Well, I don't know how many times I've won the lottery, you know, and I'm waiting for that check, but I haven't got it, and that's been going on how many years, so.
Hey, I got a check from Publishers Clearinghouse, and I didn't believe it was real until it cleared the bank.
Wow.
Well, I didn't. You know, it's like, okay, is this another one of those scams or what?
Wow. So Jackie, I know this is off the subject, but tell us about your award that you received. Congratulations. I'm going to keep saying that because
Thank you.
I think that's great.
Fellow status with the American Psychological Association is when you've reached a level that you've made contributions nationally and internationally to the field of psychology in general. But then I received fellow status in the Division 18, which is psychologists in public service. So reaching that level in working in the area of psychology in public service. And the other one was also, I received fellow status in the Society for Women in Psychology. So in association with my work with girls and women.
Wow, that is so cool.
Thank you.
That's awesome. Yeah.
Congratulations.
Thank you. I was telling May at the beginning that it was really kind of strange because all of my materials went for the nomination went in over 2 years ago. And last January, no, maybe it was, yeah, I think it was in January, I got an email saying, I just found all your materials on my desk and my computer crashed last year and I think I lost it all. And so are you okay with us sending it through this year? So like I said, everything was sent in last year, but my materials were lost. And so because the person's computer crashed and she found it on her desk when she was moving some papers and contacted me and then resubmitted everything this year. So last year I thought, okay, well, I just, you know, I didn't meet the criteria, so.
Wow, that's awesome. That is so cool.
Yeah, I was really surprised at how broadly the notice went out. And you are all welcome for all the information. I hope it was all helpful and that if there are other things specifically that you'd like more information on, let me know and we can start working on trying to pull some of that together. You know, anything that I can help to provide, that's what I want to do. As I said, many people that responded to me about the award that, you know, I stand on all of your shoulders. You guys are doing the work and the things that you do allow me to do what I do. So thank you for all that you do and for sharing that with me so that I can then help others with their programs. So I really appreciate all of that. And I appreciate all of you. Okay. Anything else? Any other questions, comments? If not, May, I think we're through for this.